Hey guys, Sid here in the AAFE Training Center. We have a wonderful new patient in the chair today. We're going to do some lip filler and some neurotoxin. You can see here we are starting with the lip filler, and you can see this patient has been cleaned off really well. I did remove her makeup and use some alcohol to clean the site. I am going in with a medium dermal filler and really just enhancing these beautiful lips that she already has. So I'm using the needle that the syringe came with in this case, and just applying some of that product right into the lip, placing nice linear struts of product using what we call standard volume technique. We have a million different fancy techniques that we can use to kind of enhance and change patient's lip size and shape, but in this case she has really beautiful lips to start, and she has the shape that we want and that she desires. We just want to add a little bit of volume. So you can see that I'm kind of holding the lip taut, advancing my needle, and then going ahead and laying some product. I'm retrograde injecting that product, so I'm moving out as I place the filler. She has been numbed topically, and the numbing agent that we use is very effective. So you can see here she's, flinching just a little bit. It is pinchy, but she's doing overall very well. I'm kind of going from one side to the other and just really enhancing the already beautiful lips that she has and laying just a tiny bit of product. You can see here a little bit of bleeding that is completely normal, a little bit of asymmetry to start, so I'm going to go in and try to kind of even that out. It may not be, exactly perfect, but to try to get us as symmetrical as possible. Using some gauze to manipulate that product, not too firmly. We don't want to deplete everything we just placed, but I do want it to kind of integrate into the tissue, make sure it's not lumpy bumping, make sure that that product is sitting really nicely. So just kind of palpating, feeling that product, and massaging it where I see necessary. Here we are kind of showing her the lips, and she did love them, but she actually ended up requesting more. So we went ahead and placed a little bit more product. Here we're kind of just talking about results and then going back in. And you can see her lips are cleaned once again, and we're just adding some slight volume to the lip, just because that is what she requested. So most patients, when they are a first-time lip filler case, you will see that they are kind of, shocked when they look in the mirror. They can look swollen and they're kind of larger than they anticipate. In this case, she wanted more, which we love. And you can see here that I did kind of check some cap refill on that upper right side of her lip. It was just looking a little blanched for a second. Sometimes when you place filler, you can have that. So it's always a good idea to check cap refill, make sure that blood is perfusing and that we like the color of the lip. You can see that went away and cap refill was completely within normal limits. So that is always good to see. Here I'm just going in and placing a little bit more product. We are not going to quite finish the syringe. I never put more than one syringe in one sitting. That is just my personal kind of treatment restrictions. I want to kind of build these lips gradually over time, and I don't want her to get too swollen. So I don't place all that much filler at each treatment, but you can see here we have achieved some beautiful results. I'm just putting on some Comfort Tox lips here. Nice balm following the procedure. It has hyaluronic acid, it has arnica, what else? Essential oils. So it's a really nice agent to help heal the lips. It's nice and clean. And look at those shiny, beautiful lips. I mean, they look fabulous. Moving on to neurotoxin. So here I am marking up the patient. I'm marking lateral border to make sure that I have the entire forehead kind of covered. I'm not doing too many injection sites on her and not doing a lot of neurotoxin just because she doesn't have a lot of movement. So we don't need to go overboard there. I'm marking up her glabella, so her procerus, and then 2 corrugators. This patient is relatively young. And clearly does not, animate too much. She doesn't have any static creases. So we're just going to treat very lightly on her just to kind of keep things calm, much more of a preventative treatment. So there I am all marked up. I'm moving down to lower face. So I'm marking mentalis and DAO just to kind of relax that pull. To make sure that we are not kind of contributing to that early joweling, pre-joweling, that is constantly pulling and creating, that saggy lower face that we don't like. So much more of a preventative treatment. You can look at this patient and just tell that she's a clencher, just by how strong she looks. She looks boxy back there, and she is well aware, and she also does clench and grind, she says. I marked her antegonial notch just kind of as a landmark. The anterior border of the masseter will always fall directly into that antegonial notch. I'm feeling the edge of the mandible and going about 1 centimeter up and slightly posterior. We do not want to inject the masseter too superficially because the rosorius attaches superficially, and we do not want to make a person have a crooked smile. That is never the goal. So that's why we mark so precisely and so carefully. Here I am injecting. I'm using a ComfortTech syringe. It's a 0.5. They are multi-beveled, 31 gauge, 8 millimeter. They go in really, really, really nicely. I am kind of just stabilizing here, making sure that I have a hold of the muscle, supporting that orbital rim so that I don't have any product leaking down to unintended muscles. And then I hold a little bit of pressure there, a little bit for my peace of mind and just to be sure that we don't have any product leaking. Here I am injecting up and away so that we are going away from the eye and just a little bit of extra pressure there. Now I'm injecting the orbicularis oculi and I inject up and away. I hold that skin really, really taut because if a patient is going to bruise from Botox, which they will, you can see right there, she'll have a little bruise. It's nice to hold it taut so that you can kind of see if there are any prominent vessels right there. Mentalis, I'm kind of isolating that muscle and going straight in, right into the belly of that. And then DAO, I always feel the muscle pull. So I have them animate and I actually feel the muscle movement because that is what we are treating. I inject away. We always want to avoid DLI if we can, so that we don't kind of, affect the patient's smile. I want to stay a little bit more laterally. Masseter, you can see here I'm going straight in 90 degrees all the way to the hub. I did go in 2 different sites right there, and then I'm also injecting the deep masseter, which is a little bit higher. Hers felt very, very tough, and it's just from overuse. These muscles get very strong and overworked in our patients with bruxism who clench, grind, things like that. And you can see here I'm going in a second site as well, but very close to each other so that we don't hit a muscle that we did not intend to. Moving up to temporalis, hers is very, very strong. The video does not even do it justice, but she is very strong. I cleaned right before injection and I'm injecting up and away in 2 different sites. You can inject anterior, medial, posterior, kind of wherever the patient needs. And you can see there when she kind of clenches, you can see it really, really activate. So there you have it. That is this patient's treatment. We will see her for a follow-up in 2 weeks. Make sure she's loving everything, just cleaning her up and sending her on her way, making sure that she doesn't touch, lay down, or sweat for 4 hours, and that she follows up with any concerns. Thanks for stopping by, guys. See you next time.